There were surgeries before that we wouldn't attempt laparoscopically because of the complexity of the cases and difficulty getting into these small spaces. The robot has 4 arms, and one of them is a camera. And typically a surgeon obviously operates with just 2 hands. My hands are small, but the robot's arms are actually smaller. They're 8 millimeters. So these robotic arms become the extension of my hands.
So the robot really allows us an extra degree of freedom. It allows us to move our wrists. It allows us to do things that straight laparoscopic instruments don't, and that really allows us to be more precise and more skilled in what we can do laparoscopically.
It provides me the ability to see areas better, so visualization is more improved. My dexterity and the manipulation of tissues is improved, and I'm able to reach areas that I probably wouldn't be able to reach if I was using a traditional straight stick laparoscopic instrument.
Once your end effectors, the ends of your instruments, are where you want them to be, there is no limitation on range of motion or ways to move those end effectors.
Now we can perform many complicated operations through smaller bandage-sized incisions, and patients recover much faster because of that.
So patients are able to go back to work faster, they're able to recover faster, they have less fatigue, and patients are happier overall.
And if patients are getting faster operations that maybe we couldn't quite do in the same way without the robot, I think that's going to lead to better outcomes and less pain and faster recovery.
When I am working at my console, the arms or the instruments are actually doing everything that I'm doing, so they're mimicking me. So the robot is not actually a separate entity, it's not doing the surgery by any means. It's still me, the surgeon, doing it, but I'm using a technology to help me be better at what I'm doing.
I'm sitting in a console, looking in a visor, 3 dimensions, I have my wrists, and I have no physical fatigue when I do my surgery. So the robot brings a lot of advantages in minimally invasive surgery. So I feel as fresh and vibrant, energetic, and rested on my 3rd case as I do on my 1st case, or in my 2nd hour as I did on my 1st hour.
You know, we don't really use a new technology just because we love new technology. We use it because it has proven benefit for the patients. The technology is rapidly advancing, and I'm definitely hopeful that it keeps advancing for the benefit of the patient.
Robotic surgery is a very safe alternative to conventional surgery, and I think that several years from now it is going to be the mainstream surgery. And I'm very glad to work with Northern Light Surgery that we are in the forefront of technology.